as an anesthesiologist, 20 years of experience, I monitor patients for a living. And throughout my career, one of the biggest inconveniences, I would say, both for myself and for patients, is the traditional technology is so restrictive. Wires and cables and tubing, and it's so easy to get tangled up. The first thing that attracted me to the Caretaker was the fact that it's wireless. It's a simple, I call it a bulky wristwatch, but just wear it on your wrist. It attaches to a finger, and patients are free to move around. We even have patients sometimes ambulate while still being monitored, which is really nice. It's super simple compared to any other technology that I've used in the past. We found it to be equally as reliable, equally as accurate. Early on, I validated readings with the manual blood pressure periodically, and pretty quickly stopped doing that because it is accurate and reliable. As far as patients' experience, the other thing, in a ketamine clinic, patients are being monitored while oftentimes in a significantly altered state of consciousness. And I believe that the Caretaker is much less disruptive to them compared to having a person go in and apply a standard blood pressure cuff, or even with a non-invasive cuff that inflates every few minutes. The Caretaker just kind of disappears into the background. In fact, we had a patient recently who said, "I really love this new monitor that you use. I would hate to have that big thing squeezing my arm every few minutes while on ketamine. It would be really confusing and disruptive." So we have found it to be a significant improvement as far as the patient experience goes. Early on in the practice, we were very careful about the things that we invested in. We had limited capital to get started, but I felt like Caretaker was worth the experiment. Initially, we purchased one unit. We have 3 treatment rooms, so we can run up to 3 infusions at one time. And we invested in one Caretaker unit, and very quickly, because of the improvement in the patient experience, as well as the improvement in our own efficiencies, we, as soon as we could afford another unit, once that capital became available, cash flow reached a point, we purchased a second unit, and then again, very high priority was to purchase a third unit. So we now have one Caretaker for each treatment room, and as soon as I can find the capital to get a backup, I'll have a backup. The data that we get from Caretaker, we actually use a electronic medical record called Plentyfusion that's specifically designed for infusion therapy. And Caretaker integrates with Plentyfusion such that the vital signs automatically get uploaded into the electronic medical record. And so that, for one thing, improves reliability of record keeping for medical decision making, for chart reviews, and as a legal record, it's highly reliable. But it also relieves me of the burden of documentation because it's automatically documented. So when we end a session, because that information has already been uploaded to our electronic medical record, I obviously review it, make sure that I agree with it. Once that's done, we terminate the session, and we don't save the data from the Caretaker session. We just end it and keep our medical record. But I do understand that all of that, every heartbeat is recorded and available if that's something that someone were interested in. But we don't use the data other than what is uploaded to our record. Okay, I have had an excellent experience with customer service, technical support. Um, we've had a couple of mishaps. One of them, absolute user error. I did not read the instructions and partially disassembled my unit trying to get the finger cuff disconnected, and so it was rendered useless. I called, and they had one in the mail that day being shipped to me express. So I think it was the next day I received a replacement for it. So that was my first experience with customer service, and I was really impressed. I've had a couple of other things. Had one unit where the display it had an impact, and the LCD display on the wrist unit cracked, and it was covered by the warranty. So we sent it back and got a replacement very quickly. So I've had an excellent experience. I believe the initial setup was less than an hour. We got things set up. We've been using it for 1.5 years now. I have brought in additional staff members. It is very intuitive. A couple of simple steps to get it calibrated, and then it's just automatic. And so our staff has had a really good experience with it. The patients love it. Our staff loves it. It uploads to our EMR automatically, so it creates a reliable record. So I love it. We've had really no problems.